Hi everyone, this is Dr. Anne-Marie Clark here again with you, connecting with folks in the community and answering your questions about autism. This week I wanted to chat with you about the recent changes in the diagnostic classification for autism that went into effect in 2014. These changes have posed some confusion for families whose children have been previously diagnosed with Asperger's disorder or PDD-NOS. First and foremost, when thinking about the changes in criteria, I think it's important to remember that these changes reflect our best understanding in the scientific community about autism, and that is that autism is a brain-based lifelong disorder. This recognition is important because it helps us dispel myths that are still out there that autism is caused by bad parenting or other issues. Secondly, the diagnostic change reflects and acknowledges that autism is truly a spectrum disorder, where people's symptoms in the area of social communication difficulties or behavioral difficulties exist on a continuum from least significant to most significant, and that each person has a highly individualized symptom pattern that presents and must be addressed through effective treatment. And that leads us to the third important change in the criteria, where the diagnostic criteria really hones in on the level of support that a person will need, from minimal support for a person who is demonstrating few symptoms of autism that are getting in their way, to a person who requires a more substantial level of support where they are demonstrating more significant symptoms of autism that are interfering with their ability to be successful in the home, in the school community, on the job, or elsewhere in the social environment. So this leads to a question submitted by Brooke, who was wondering how a change in diagnosis from Asperger's disorder to high-functioning autism might impact the services that are available for her child. And while it's difficult to answer that question individually, Brooke, or specifically, I think the overall answer is it's likely to have minimal impact. Once a child has been diagnosed with autism, the most important thing is to tailor the services to the individual areas of difficulty that the person is presenting with. So if the child, for example, is having difficulty making or keeping friends in the school community, you may want to consider a social skills group intervention. If somebody, however, is faced with more symptoms of anxiety, which many people with autism are challenged by, then that person might do better with an outpatient course of therapy that has some strategies of cognitive behavior therapy woven in to help them experience a greater degree of comfort and relaxation while out in the social environment. And finally, for someone who's of working age who is interested in getting or keeping a job, if they require a little bit of support for either of those, they may wish to seek out employment services through a community provider or get access to those through the Office of Vocational Rehab. So in short, what I would recommend is that you seek consultation with a school counselor, a school psychologist, or a behavioral health treatment provider in your community who specializes in autism. Once they talk with you, interview your child, and get to know your child better, they would be the person with the best advice on what type of service would be most appropriate to address the needs of your child at any particular time. So I hope you found that helpful. I encourage you to continue to submit your questions through the link below. I'll look forward to answering them in future postings, and I hope to see you again as we keep pace with autism.